Welcome everybody. My name is Dr. Tushar Deoras. I am the Chairman and Managing Director of Astute Counseling Academy. We are a US-based academy having the centers in Philadelphia and Chicago, and we have our own affiliated residency hospital in New Jersey. And we have been guiding the students for various courses in United States for last 25 years. We have been recording very specific videos now. I have discussed a lot about the residency programs in United States, the physician assistant program, two very premier programs. How even without USMLE you can become and practice in United States with a physician assistant program. Even Ayurveda, homeopathy doctors or physiotherapists can practice allopathy in United States. Lot of pathway programs. Now residency has been a #1 program in United States, and there has been a major changes which is happening in last 1 year. There has been a major changes even as late as last month also, lot of changes which is happening. So I want to really discuss today the whole new paradigm has come. The residency admissions has become a so easy admissions in United States. If you go to the official websites of nrmp.org or usmle.org, you will find the even last 3 years cutoffs for various streams. And the seats are going vacant after even 4 rounds of admission, that is match and 3 SOAP rounds. And that is why this year 1 more round of SOAP is been added, and now it is a 5 rounds plus 1 institutional rounds. Still surgical clinical branches seats are vacant. So what are the changes? I will briefly discuss, and I will be very specific as regards its impact onto international medical graduates. What is international medical graduates? Means those who have done MBBS outside of United States and Canada. So it may be an Indian student, you may be doing MBBS from China, Russia, Ukraine, Georgia, Kyrgyzstan or Philippines, any country. Now this is very important part of it. So first change which I had discussed in my previous video also is the step 1, USMLE, US Medical Licensing Exam step 1 becoming pass and fail. Now this is a great change because previously the Indians were only struggling with this exam, USMLE step 1. Now the USMLE step 1 syllabus is completely revamped, and 60% is the clinical, means hospital experience. And the step 2, which has the 2 parts, step 2 CK and CS. Step 2 CK, clinical knowledge, which is 100% objective type test, and clinical skills where you have to actually meet the patients physically. 12 patient encounters, you have to speak with the patient, diagnose with the patient. The step 2 CS was also difficult for Indian students. Now the step 2 CS has been permanently scrapped. Now the step 2 CS, which is difficult. So Indians were struggling with the step 1 examination and step 2 CS, and both is almost like eliminated. It is a step 2 CK, clinical skills. And that is why the hospital experience is going to be the king. So it is very critical that your communication with the patient. So don't go to China, Russia, Ukraine, Georgia, Kyrgyzstan, non-English speaking country. If you want to do MBBS, you should do from an English speaking country. So India, there are students definitely doing. USA has come as a next MBBS discussion, but you can view my other video on YouTube onto the MBBS, which is cheaper than India. Now, there are 2 parts. There are students who are currently studying in 1st year, 2nd year, 3rd year, 4th year or in internship. And there are students who have passed MBBS. I will address both the parts of it, how they should now address. The most critical part is no longer a USMLE. USMLE weightage is just 20 to 25%. But even the step 2 CK 300 marks exam, Indian students used to get normally 240 marks easily. Now you may require 250 and 260 marks. And how it is achievable? And besides USMLE, it is 80% is other profile. You are completely academics part of it, what projects you did, what internship you did, what observerships you have done, how many research papers, how is the way the American diagnose and way Indian diagnose is different. So hospital rotations is going to be critical, and it is not only 1 year of hospital rotation like in India. China, Russia, Georgia, so there is no hospital rotation because of the language gap also. You are not able to communicate. So what the students to do now is completely different than what they did last year also, because now till last year step 2 CS was there. Your clinical experience was tested perfectly by the step 2 CS. Now the step 2 CS clinical skill test where the 12 patient encounters is not there. That means to compensate that step 2 CS, you have to provide the additional evidence. Previously, 2 months of hospital rotations in United States was sufficient. After you complete your internship, student, you used to fly down to United States, work 2 months there in US hospital, understand, get a letter of recommendation. Now it is no longer valid. Now you should have minimum of 6 months of clinical experience in a US hospital. 6 months of clinical exposure. Our international medical graduates, if they want a straight admission into your residency program, must have 6 months of hospital experience in United States hospital. It seems difficult because it will cost you money, you will to stay longer duration, and that is why the residency hospitals, the program directors, the USMLE and everything has made a major change. They said कि virtual internship or virtual clinical rotations is as effective as in physical form. In fact, some of the universities or program directors are writing that a virtual thing will maybe a better because it is a one-to-one communication. You can actually talk to the patients through video conferencing links. You can interact with the doctors. It is like in place of physical, you are online with a doctor for 8 hours. You will be interacting. So every hospital has specified programs for virtual internship or virtual clinical thing. And what they do is they guarantee you minimum patient exposure. That is very critical. So some hospitals may say, every day we will get you 30 clinical exposures with the patients. So 30 patients you will be able to interact, you will be able to diagnose, and that you can speak with the doctors. So during your second year, third year, fourth year, every year you may do 1 or 2 months of rotations with the US hospital virtually. You are sitting here in India or China or Russia. So those students who have gone to China, Russia, they are going to struggle. For them, it is very critical now. If you are in China, Russia, Ukraine, Georgia, you should take the virtual clinical rotations while you are in a country. It's really benefiting the students. Those students who has gone through the virtual part of it, they say this is far better than even physical, because in a physical there may be 15 student, 20 student, and doctor is addressing 15 students, 20 students, whereas when you are in virtual, it is one-to-one, literally one-to-one. And when it is a doctor is talking to you in a single student scenario, you are talking to the patient, that is going to be very effective part of it. You save huge amount of money. And for every 4 weeks, means 1 month of rotation, you get one letter of recommendation. Think of a situation. If you are doing 4 months of rotations in India or China, Russia, last 2 months you go to United States and do, you have 6 letter of recommendation from a top United States doctor. And if you are able to do this, it is a cakewalk. Those who have completed already the internship may not be able to do this. So for them, we suggest it to go 2 months to United States. Even for April dates are available. There is a lot have been commercialized also because slots are very, very limited for them. Even those who are in a firefighting mode, we can provide even 15 days, means 2 weeks of rotation with a letter of recommendations also. Even that is a possibility. If those who have in a last stage, they are not able to fly down to the United States and still want to do the virtuals are acceptable as a way forward. It is not a mandatory now you should be going to United States and completing it. As Astute, when we talk to the program directors, there has been certain program directors which believe it should be a combination of virtual and the physical, because there are certain advantages being a physical also, because you get into the environment. You will be interact with all types of, from nursing staff to the patients to how the administration works, how the whole hospital works. Those things are there. So Astute is going to provide the clinical exposure to the students now. So whether you are in a first year, we will start providing you the clinical exposure from the first year itself. Not first year we will do the bridging part of it, where we will start providing some material to you, but actual rotations will start from a second year. And we will try to make it as cost effective as possible. Ultimate aim is to do the post-graduation residency in United States, which is a free education. They will pay you the stipend. So whatever money you may spend in the rotations can be easily recovered. You may be also knowing that National Exit exam is becoming a reality. National Exit 1 and National Exit 2 is again replica of the USMLE Step 1 and Step 2 CK. But biggest problem is not about the National Exit exam, but biggest is Indian government has scrapped mandatory 1 year of internship. So if you do the internship in any other country, there is no need to do it internship. And as you may be also knowing, that you can do the internship only if you pass the Step 1, the National Exit Exam 1. If you pass, then only you can do the internship. And National Exit Exam 1 will again be 60% hospital exposure. So you have gone to China, Russia, Ukraine, Georgia, you have no hospital experience. You have the theory very perfect, but you have no hospital experience. And you have to first pass exam before doing the India externship, which is also scrapped. So this US rotations or clinical rotations or internship, whatever you may name it is called, okay, you should do now the international students while you are there in the first year, second year, third year, fourth year, or even if you are doing the internship. And another big advantage of clinical is you are not disturbing your regular schedule. Because finding out 1 month or 2 months of holidays during first year, second year, third year, fourth year is very, very difficult for you. The time zone, US time zone and Indian time zone is really helping you. You may start your internship in United States at 6 o'clock in the evening and at 2 o'clock in the night you finish it. That will be the beauty. You can do the college in the morning. You may have to slightly struggle during the internship time, but you have no choice to do that. Astute Academy will guarantee you. A lot of students ask me whether USMLE passing is important, is required for the clinical rotations in United States. Absolutely no. It's all false narrative. There is no need for you to take the USMLE Step 1. In fact, I say all the students to take a USMLE Step 1 and Step 2 after you finish 2 months of rotation in United States. Never ever student should take in third year or fourth year. So things have changed very fast. It is really making easier for Indian doctors because we have critically, but China, Russia, Ukraine, Georgia, Philippines and all countries are big way struggling. So even in Philippines, we have created international batches. Okay, last 2 years, you go to United States. We are taking 2 years of internship in US hospitals. For Philippine students, we have been experts in that. And it is a specifically created batches for the Astute Academy. We have the US based company, as I said. We have our own affiliated hospital. We know the process. We are the one who admits the student. We know the first hand information. And the last thing, never ever go to any forums. Go to official government of USA website. They have all the information, including you want to know what is the last year gynecology cutoff, what was the oncology cutoff, what was the general surgery cutoff of step 1, step 2, everything is published in nrmp.org. I will show you the 4 websites which is very, very critical. USMLE.org, nrmp.org, which is a match process, admission process. Third is ecfmg.org. All international student has to register and get a certified into ecfmg.org. They will validate. And the fourth is nbme.org. nbme.org is the site, okay, which sets the paper. They have a lot of mock tests and everything there. So subscribe to my YouTube channel, astutepromo.com. You can chat with me on a YouTube channel also. My website is astuteacademy.com. You can have one-to-one call with me either through Zoom or you can personally meet me in Pune and Mumbai. So I'll be happy to meet you and guide one-to-one. We have Nagpur office also, where also you can visit it. But now with a Zoom, it is a virtual, things are working very, very strong. Book online appointment. We have the USMLE diagnostic test onto our websites also. You can take the diagnostic test also. It's a free test which we are giving to every student. So completely Astute Academy, starting from the profiling, the hospital rotations, internship, very difficult to get in United States. We are experts in that. We will get you. We have around 450 hospital affiliations where we can provide rotations in any field. You want to go in gynecology rotation, you want a surgical rotation, you want a whichever area rotations, we will be able to. Sometimes the students which particularly are open for more than one stream, they may do first year, second year you do the maybe general medicine, third year you do the gynecology, fourth year you do maybe in general surgery. We may have the multi rotations and we will get a different letter of recommendation from top doctors. Letter of recommendation plays a major role. So stay tuned with this. Please subscribe to my channel and I will be happy to assist. Thank you. So if